like to congratulate and thank the team from Janab Khalid Tima Sahab and Amin and his associates for creating such a wonderful opportunity for our people in the name of Graduates Guilds of Vaniyambari. This creates a wonderful opportunity for the people to learn, hear, and interact with the people from their insights in various subjects. Today I have come as a discussion for the medical science, whereas for that matter, any field, acquiring knowledge in any field is not going to be a waste. You need to have a basic knowledge at least, not only in health sciences, but also in literature, engineering, and technology in particular. That is the need of the hour. Before I go to the main subject of our discussion, a few words about the trends, latest trends all over the world. For a long time, doctors were educated only in the medical field. Now, medical doctors are also trained and taught with the subjects in engineering. So they are called engineering doctors. In USA, we have universities teaching the doctors on medical side one side, and at the same time engineering subjects, which consists of 6 years course. They are called as the MD PhD doctors. They are awarded as MD PhD doctors, who are basically the doctors in medical science and at the same time having qualified for engineering studies also. Why this trend? Rapid digitization of the world, particularly the medical science, needs so many innovative instruments to handle, to look into, and treat the human beings, for which they want the handheld devices, and then so many other electronic digitized devices for making the diagnosis and for various treatment modalities to be directed to the patient. Not going into the detail of all these, I mentioned these just to tell you and familiarize you of the modern trends in the world. Here, I have come to discuss about the misconception, the myth and misconceptions associated to medical science. May I have the first slide, please?
Yes, sir. Let me know if you're able to see the screen.
Yeah, very much.
Okay, thank you. Yes, sir.
The topic of the day is myths and misconceptions attached to the health science. In my vast experience of more than 47 years experience in clinical practice, I am very much disappointed from the day one that the people are attaching so many misconceptions to the day-to-day medical problems arising either to the children, the adults, or the ladies. And to quote and to begin with, I tell you, for each and every disease, there is a misconception among the public. If we dispel these misconceptions, actually be saving our public from entering into the wrong directions. At the same time, they not only diagnose themselves and then start treating the condition also. For example, I tell you, when the child gets into a fever, that could be a viral fever which is more commonly afflicting. And for the viral fever, the parents will bring and tell the doctors, "Sir, இந்த குழந்தைக்கு வந்து நல்லா விளையாடி இந்த குழந்தை 3 நாளா ஒரே ஜுரம் கொதிக்குது." சொல்லிட்டு ஃபௌரன் அவங்க என்ன சொல்வாங்க, பயந்துட்டு இருக்கிறான் போல் இருக்கு. So, because of the fear through any source, the child has developed fever. But I tell you, unless and until there is a source like infection. The fever could be a cause of a virus infection or bacterial or any other. The child is unlikely to have the fever because of the fear complex. So that is a myth. And they tell us, and sometimes they treat us also. Obviously, when the person is suffering from fever and that is being diagnosed and suspected as the fever due to fear complex, bayam, bayinditam. Obviously, they will go to home mantras, roadside healers, and sometimes tayittu. These are all the practices rendered by them. I don't do anything against from these people when they go and treat for such ailments. But the problem is the precious time is wasted here. That is very annoying. The earlier the medical condition you treat with, the better would be the prognosis and outcome. Most of the people delay the treatment coming to the hospital because of their own misconceptions and direct dealing with the patient. Self-treatment, taking drugs from the counter in the medical shop and all. Because of that, they land up in problem. Such things should go up. Second slide, please. Though this is again about the myths and versus facts. Myth on one side, fact-finding people, teachers, struggle a lot to dispel the myths and misconceptions and bring light to the darkness. Next slide, please. Now we are going to discuss about few commonly encountered diseases. We are not going to discuss about the disease in depth because I am not going to face or lecture medical students or the doctors here. With the lay people, general public, I want them to be benefited. There are certain common diseases like diabetes and hypertension. To begin with, the basic understanding among the public should be diabetes is not a disease. It is a metabolic disorder. It is a disorder in human beings for which we need to correct with our lifestyle on one side, the diet and the exercise and certain other measures like medicine, insulin, depending upon the stage of the disease, depending upon the age of the person, all. So why I have shown the picture of kidneys here? You can see the pair of the kidneys there in diabetes mellitus, whereas I have not shown the picture of the pancreas with islets of Langerhans secreting the insulin. This is mainly because there are so many complications brought about by diabetes mellitus. If the person is not taking proper treatment, not controlling the diabetic status, not bringing the blood glucose level to the normal level, he would be causing havoc to his own body system. The main organs, vital organs, which are affected are to start with kidney. It affects the liver, it affects the vascular system, it affects the nervous system, causing vasculopathy, neuropathy, and it affects the retina, resulting in retinitis, diabetic retinopathy, and loss of vision. It affects our lens in our eyes, that is cataract also. But I have shown the kidneys here mainly because majority of the people who just don't bother about the diabetic status and don't take the treatment and consult the doctor, they bring harm to the kidney. So here, diabetic nephropathy would result in kidney failure. It could be acute kidney failure or a chronic kidney failure because of the recurrent infection, urine infection, and because of the damage of the kidney. That would result in nephropathy, and the end stage of the kidney failure is end kidney failure stage, which then land up the patient to cleaning the blood from the various toxic substances with the machine. which we call as the dialysis. So cleaning the blood with the help of machine, which is often required once in a week or twice in a week, when you lose your kidneys functioning, that should be the end. So what is required is to take care of the kidneys, at least for the sake of saving the kidneys, you should control your diabetes. Diabetes is such a disease that will be hidden, not very well known to the person who is already having the diabetic status, the diabetic problem. After a time, when he finds it out and goes to the doctor, much damage is already been done to the kidney. And the myth, the misconception, which is attached here to the diabetes is, in the beginning stage, people think that plenty of urination or sometimes frequent urination in the beginning stage, I repeat my words, they think that they are very healthy. They will come and tell the doctor, எனக்கு நிறைய ஒண்ணுக்கு போயிடுது हमेशा पेशाब हो जाता मुझे क्या अभी प्रॉब्लम नहीं रात में भी 2-3 वक्त पेशाब जाती हूँ डॉक्टर साहब ऐसा वो क्या अभी तब मेरा है ना ब्लड क्लीन हो जाता so he assumed that he has got very healthy kidney. That's why he is passing urine every now and then. So his cleaning system, his cleaning machine, a pair of kidneys is working very well. But on the contrary, he doesn't know. He is not realizing that he is already suffering with diabetes, and it is the diabetic osmolality which is causing the frequency of the urine. So frequent urine passage, polyuria and polydipsia, diurnal urination, which we call it as. I am trying to avoid all the terminologies because I am facing the general public. So explaining a medical subject without using the terminology is a difficult job. I am trying my best. So in kidney diseases, in the early stage, there will be thirst and there will be a lot of urine being passed down. So which he is taking it as he is having healthy kidneys. He has to be explained by the doctor that no, it is not your healthy kidney. The kidney is suffering already and you cause much damage to the kidney because of your own diagnosis. Then we conduct some tests and come to a conclusion that he is suffering with diabetes. And afterwards, the treatment for that particular patient, depending upon the stage of the disease and all, will be diverted to save him from diabetes. Next slide, please. Hypertension, increased blood pressure. I would discuss the increased blood pressure, which is commonly called as BP patient or hypertension, mainly because hypotension, drop in the BP, is also there, but that is rare and that does not warrant any treatment in immediately required to be treated to the patient by the doctor. Hypertension is the most common and that is dangerous to our arteries, our vital organs, particularly brain, liver, and kidney. What happens in hypertension is there is elevation of the blood pressure. There are two components, systolic and diastolic. Systolic pressure is created by the contraction of the heart, and diastolic pressure is created and measurable by the resistance offered by the peripheral arteries when the heart is in a diastolic stage, which we call it as a diastolic pressure. So BP has got two components. One is the systolic pressure and second is the diastolic pressure. That is the basic information I wanted to convey. But what happens in high blood pressure is very important for the patients to know. In the early stage, the patient may have some trivial complaints like headache, heavy-headedness, dizziness, and sometimes he'll be very jittery, edgy. கொஞ்சம் நேரத்துக்கு அவர் கோவம் வந்துருக்குங்க என்னன்னே தெரியல often gets wild, shouting at family people and all. And sometimes patient will have bleeding nose, nasal bleeding in high BP. This is mainly because of the rupture of the arterioles under high pressure, and that is a warrant sign, and people don't know. And what they term it as, when a person is bleeding from the nose or the person is having a bleeding piles, that is a warrant sign for the patient to go to the doctor and confirm as to what is what, why he is bleeding. The common misconception here talked about is, when a person, or particularly a child, is bleeding from the nose, they will say that सूड आइडिச்சு, गर्मी हो गया, गर्मी से है ना उनको नाक से खून आ गया. This is the thing. Then they brush aside and proceed forward with their normal routine busy life, and they don't go to the doctor. A elderly person who is bleeding from the nose is a great warrant signal to consult the doctor, because the pressure is high. Because of the high pressure, there are rupturing of the small arteries supplying either to the heart and the brain, means immediate death. But such ruptures, when happening in the nasal area, mucosa, that is a warning sign. Similarly, a piles bleeding is also a warning sign for the patient to check the BP. Whereas they simply misconceive this as to some other reason, like just now I told you that it is because of the heat. சூடாயிடுச்சு, அதனால்தான் மூக்குல ரத்தம் போகுது. ரொம்ப சுத்திட்டாரு வெளியில வெயில்ல, அதனால்தான் ரத்தம் போகுது. These are all the causes they end up telling and then forget the matter. That should not be the case. Such warning signals should be attended with the doctor's consultation immediately so that greater damage is not done. Next slide, please. Next comes the strokes, which is also related to most of the cases high blood pressure. By meaning stroke means there are two types of strokes. One is the heart attack, which is called heart stroke, and another is brain attack, the brain stroke. The stroke here refers to the immediate reason for the heart attack or the brain attack. The attack word is replaced as the stroke. What happens in the stroke? Whether stroke comes to the brain or comes to the heart. The narrowing of the arteries, sometimes occlusion of the arteries with the blood clot and atherosclerosis spots. Because of that, the blood supply to that vital organ, that is heart or the brain, is delayed. When the blood supply is compromised and the sufficient volume of the blood is not flowing to the heart muscles, then the myocardium, the heart muscle, will suffer until up to the blockage is 80 to 90%. Sometimes patient may not know that the blood vessel is being occluded gradually, and that person is having 80 to 90% of the occlusion. Only then he may have some chest discomfort or a heart attack directly. Because of the excruciating pain, he will go and consult the doctor. So what we need to do is, I repeat again, when there are certain warning signals to tell you that you are suffering from high blood pressure, you need to go and consult a doctor and find the remedies to control the blood pressure. Had you taken those warning signs in the beginning itself with due seriousness, you would have avoided such heart attack. But of course, heart attack is not only because of the high blood pressure, because of other factors, that is occlusion of the arteries, and occlusion is not only because of the clot, it is because of the atheromatic plaques which is being developed here. That is shown in the picture. Similarly, the occlusion of the brain vessels will result in brain attack. Brain attack may happen because of the embolus or because of the inherent occlusion of the arteries because of the atheromas. I don't want to go into details, the medical terms of atheroma occlusion, or because of the embolus, which comes floating away from a distant side. But what you need to know is whether it comes to take the treatment and precaution for the heart attack or the brain attack, you need to understand your body language in the beginning also. Again, I told you that because of this, you may get dizziness, heavy-headedness, and similarly, when you have the occlusion of the brain vessels, you may have sometimes ataxia, heavy-headedness, and all. And again, you need to pay attention and take seriously to these trivial signs and symptoms happening in the middle itself. That's what we call it as understanding one's body language. The body language is very, very important. We should not neglect the body language. For example, you get up in the morning and you feel that your body is not as usual as you feel every day in the morning. You feel tired in the morning itself. There is heavy-headedness, headache is there, and loss of sleep is there. You should sit for a while. You should sit for a while before you start your busy life of the day. That is to understand the body language. You should put several questions to yourself. Why I was perfectly all right till yesterday evening when I went to sleep, and now I am having heavy-headedness, and now the headache is there, dullness is there. What? We will definitely get an answer to the questions. Answer should be like this. If you are a bit conscious about the body language, you will get the answer that yes, I was actually roaming about, excessive work was there, I was very tired, I exposed to sunlight, it could be because of the stroke, not slept well, or it could be because of the loss of bowel movements, constipation. So constipated person also feels not pass the stool for 2 to 3 days, he is likely to get the heavy-headedness and all. At the same time, serious diseases also it is a warning signal. You try to interpret the cause. If you find the cause, it is okay. If you don't find the cause for the body language which you feel, you need to go and consult the doctor immediately. That is very, very important. Next slide, please. Bone fractures and tear of ligaments and tendons. Why I included this topic is lot of misconception from age-old days are attached to this. Whenever a fracture happens, those days, even today, the patient will, the attendants, relatives will rush the patient to, obviously the only destination is Puttur. I ask you one thing. If Puttur is the remedial center for the treatment of the fractures of the long bone, then what about the patients who get fractures in Bombay, Calcutta, or North India, Delhi? Where do they go? It's all the trends which is set here. Because of the word of mouth, it spread. If you go to Puttur, it will be healed. And there are so many stories built upon around the fracture healing and all, which I have been hearing to from the public in my life. It's all stories. It's a myth attaching that. Actually, what is needed to treat for the fracture of the long bones is very important. The basic necessity which the doctor is doing to heal the fracture is very important. Next picture of that bone, please. Bone. Yes. You can see the long bones here, fractured in the middle or at various levels. So what is important for the treatment of the long bone is, before I go to that, I tell you that God has given tremendous abilities to human body for the self-healing of these bones. What is needed is, we only need to approximate the broken edges in such a way that they are face to face. Both the broken edges are facing each other and they are cemented together. But what happens in fracture is, soon after the fracture, because of the strong muscle pull from either side, the broken fragments are pulled apart. Depending upon the force which is more, it will be pulled either upward or it will be downward, and then the fractured ends will stick like this. If the fractured ends are staying like this will not heal. it has to be pulled down, and then it should be kept as facing each other. The broken end should be faced to each other. If that is kept and splintered, then by nature, the bone will be cemented, calcification, and there are long process, different stages of healing is there. And then both the fractured ends will heal and it will become a strong bone just as he was in a matter of 2 months maximum. Afterwards, he can use that limb normally. But what happens if the fracture is not treated medically, scientifically in a proper manner is, if the patients are taken to such roadside healers, what they do is they apply some talais and all, which is famous for several years and centuries, and then they put a splint. The splint is not put properly, and the cut ends will be by the side of each other, and they are not being approximated to face each other like this. In this case, the fractured end will heal in a malunion position, we'll call it as. If there is a malunion, then if it happens to be your leg bone, here also the leg bone is shown here, femur, because of the leg bone, because of the malunion, because of the overriding of the two cut edges, there will be shortening of the length of the limb. If there is a shortening of the length of my leg, then even if the bone heals, he will be having a limping gait. He will limp for life together. So to avoid that, what we need to do is, we have to do the approximation of the cut ends, and it has to be treated by an orthopedic surgeon in a proper way. Nowadays, tremendous opportunities available because of the advancements. We have got nailing, plating, everything is there. And when it is not possible, there is joint replacement also, depending upon the severity of the condition. So the misconception carried by masses that when the bones are broken, go to a healer. He will eat quickly. It will not be healing with the help of a medical doctor. If you go to a medical doctor, that will not, cut ends will not reunite, and you will be limping forever. Whereas the person who is going to such people will have the shortening of the limb, non-healing, and then he will be having a limping person for his lifetime. So we should dispel that misconception that bone fractures ought to be treated by roadside healers, malingerers. Next slide, please. One side, please. Any other I missed before this? Before this slide, any other?
This one is there, sir.
Yes, yes.
Okay.
I was talking about infections. Most commonly, the infections are either viral, bacterial, but in India, Bangladesh, Pakistan, where hygienic condition is in a very pathetic situation, personal hygiene, sanitation is very poor. People often infected with amoeba, which is called as amoebiosis. The picture of the amoeba, you can see a protozoa, and this is common in Indian population. Here also there is a myth attached. That's why I included this topic. The misconception. Before that, I want to tell you what happens in amoebiosis. If a person is infected with amoebiosis, he will have frequency of the stools, semi-solid stools, 3 to 4 times a day in abundance. Moreover, he has to gush to the bathroom. He will not have the ability to control the stools for a while. He will go to the bathroom and immediately he will pass the stool. And that too, that stool will be in a fermented stage. So that is called amoebiosis. This kind of stool is formed by the infection of amoeba, and this comes mostly from the outside eaters, particularly the hawkers, roadside sellers. This pani puri and bel puri is the best source of amoebiosis, typhoid, cholera, and gastroenteritis of all sorts of things. People relish this bel puri and pani puri from the roadside hawkers but they don't understand what poor kind of sanitation under which they are prepared. If you want to relish pani puri, or bel puri, you spend some time, learn to cook how to cook and prepare that bel puri and pani puri. Cook it to yourself at home and don't go and eat from the hawkers from outside. Here, what happens in amoebiasis is, in the amoebiasis, there is frequency of the stools, uncontrollable stool. That's the thing happening. And 2 to 3 times a day. In the beginning of this stage, development of this stage, what the patient think is, oh, I don't have any problem passing the stools. Daily 2 to 3 times a day, I cleanly pass the stool and get rid of my bowels free. But that should not be the case. That is a misconception. Actually, if he is not able to control the passage of the stools, if the frequency and urgency of the stool increases day by day, he should go and consult the doctor as to what is really happening, what is wrong to his gut system and digestive system, which he fails to understand. What they say, it is a healthy condition. Some people, most of the people are missing the bowels in their day-to-day life. They are constipated. They spend a lot of time in the bathroom. That's not the case for me. I go and come within 2 to 3 minutes. I am healthy. It's not like that. So it is a misconception that they are healthy because they are passing in urgency and there is no time spent in passing the urine, no time spent in the toilets. Next slide, please.
Sir, shall we go to the viral infection slide?
Yeah. Is that the one last one? Yeah. Viral. Let that be there. Let that be there.
Okay.
Actually, the previous, let it be there. Actually, it is a lengthy talk. If we talk about the diseases and diseases itself in elaboration, that is not the scope of the time. That's why I am going to adhere to only the misconceptions attached to each of these diseases so that people are warned of as to how to understand the onset of these diseases and when to go to the doctor, when not to, without the loss of time. Before that, can you go to the brain and heart picture again, where one important information I missed to tell? Retrograde. Yes. Here I wanted, but forgot to tell you, these heart attacks and the strokes are time bound. Time is very crucial here to tackle the disease. If somebody gets a heart attack, the early golden hour, we call it as 2 to 3 hours, is very, very important in handling and treating the case. If that golden hour is lost, everything is lost. Because up to 2 hours, our myocardium, the heart muscle, can compromise somehow because of the deficiency of the coronary blood supply and deficiency of the oxygen, hypoxia. Afterwards, there will be a death of the myocardium. If the myocardium means the heart muscle, dies, it is irrevocable. The death muscles will be always there in the heart for his lifetime. There will be patches of myocardial death in the person who has suffered with heart attack. Had he understood the alarming signs in the middle, had he been immediately to the doctor to seek the treatment for the heart attack, there are good drugs available in the name of thrombolytics, and for brain thrombus, very, very high profile drugs are there, which are very costly also. If that is being injected, then the person will not be left with the paralysis. Otherwise, brain damage also will occur and he will be suffering from brain damage and then paralysis, numbness. The residue will be there for his lifetime. If it comes to the heart, it is the same thing. A massive heart attack will leave the heart damaging for the permanent of his rest of his life. So later on, he will have the bypass surgery or stenting, whatever is suitable and suggested by the doctor. But whatever damage already done due to the delay in treatment could be there for a lifetime. So if you want to save the myocardium, if you want to save your brain immediately without resulting in any damage to the brain cells or to the myocardium, you need to understand the crucial period. That is the golden period, we call it as 2 to 3 hours. Within that, you should reach to the center where they will be injecting IV drugs and the dissolution of the clot will happen, or immediately the passage of the blood will be restored to the target organs. But whereas the time delayed, thinking that that person is having gas, whenever a person feels that he has got some discomfort in the chest, means it is not the gas and gas alone which is causing that problem. Gas is the only thing which is coming in the minds of the public. Okay, sometimes gaseous erections also may cause. Dysphagia also may cause. And there is a disease entity, a GERD, gastroesophageal reflux, also will cause heartburn and gas. And that may also cause the disturbances in the chest. But it is up to the doctor to exclude these minor diseases and come to a conclusion that no, you are not suffering with the gas. You have developed and you have started developing a more serious disease like going to heart attack, the impending heart attack, the impending brain attack can be very well dealt with immediately without any tissue loss and damage, and restoring the blood supply to the target organ immediately because of the availability of the latest drugs available. What is available in USA and European countries is now available in India. Gone are the days to go to America, Europe, and all to the distant places to get your treatment. Now people are coming from there. We are equal and sometimes more efficient than them. They may use the high sophisticated machines like robots and all. But again, when it comes to get the treatment with the robot, again, is the doctor's efficiency which is going to count, who is handling the robot. The outcome depends upon the doctor's skill. Next, please. When I was talking to you about the bone fractures, I wished to about the mention about the avulsion and the tendon and the ligamental tear. Those things cannot be diagnosed by a roadside healer because that needs sophisticated instruments. A person who is having constant pain in the knee or the shoulder joint, not necessarily that he should have fractured his bone. There will be avulsion of the ligaments and the tendons also. That can be only be diagnosed with the help of MRIs. And without the help of the MRI, one cannot diagnose the damage to the tendons and the ligaments, and which can be very well cured by the sophisticated treatment by the orthopedic surgeons in a well-placed centers. Now coming to certain common diseases. See, to start with, I put viral disease and common seasonal fever, jaundice, measles, mumps, rubella, chickenpox, and dengue. You might have heard of all these names at some stage of your life. The viral diseases are very common. It is self-limiting. That's why I put it as self-limiting diseases. All diseases are the self-limiting diseases, which will come and go, where the doctor is not going to do anything dramatically to cure the disease. It is going to stay there for the number of days it has come for. And then after a period, each of these diseases will have an incubation period, and at the same time, it will have the viremic stage, and then it will leave some sequelae, post-infection sequelae, and go off. So what the doctor is going to treat these diseases, he will help you, he will support you with the due to damages caused to you because of the infection of these diseases. For example, I start with jaundice. There are so many types of jaundice. It is called infective jaundice. There are other types of jaundice are there, like hemolytic jaundice and all, which is common to neonates and all. I'm not going to go into the details of such afflictions because I have chosen the topic to tell you, to warn you about the misinformations which you have from the ages. I would like to tell you about the jaundice, the infective jaundice only now here. The infection is also varied. depending upon the genetic type of the virus which is infecting you, there are so many sub-serotypes and all. That is called jaundice, hepatitis A, hepatitis B, C, E, and all. Of this, hepatitis B jaundice is really posing a problem to the patient, whereas other jaundice will come and go and stay there for 3 weeks. Initial period, the jaundice will be less. Then graphically, if you plot, the jaundice will increase for the first 7 to 10 days. Then it will decline gradually and it will go off without a single tablet, without any herbs. That's why we call it as a self-limiting disease. But having nothing to do in handling such viral diseases, people try to do lots and lots of unwanted things, including the MBBS doctors also. A doctor has to educate the patient. He has to tell the prognosis. He has to explain the patient about the course of the disease, why it has come, when it will go, what is expected of the patient, what is expected of the doctor. All these things are very important. But unfortunately, these things are not educated in the hospital because of obvious reasons, because it is time consuming and all. And doctors are not willing to reveal because it is time consuming. He will take 1 or 2, he will spend some 5 to 10 minutes, and then I would like to suggest him to take the lab test and all. He will categorize the type of jaundice and I will prescribe some pills and let go. But you need to understand that all these diseases are self-limiting. But what we do when we get the jaundice, manja kamale, irkhan, which is called as jaundice. What is the place, destination here in our area? Walaja. If somebody is looking at the urine yellow, he will immediately rush to Walaja. They don't do anything at all there. Why do you waste your time, money, effort? In fact, during the infection of jaundice, it is called viral hepatitis, you need perfect rest at home. You should not travel. You should not invite guests. You should not go to the relative's home. And you should maintain perfect sanitation and all, so that your jaundice is not communicable to other patients. In a way, you will be helping and taking your social responsibility also. What the diet you should take, how much rest you should take, when can you expect the jaundice to come over? All these things are very important. Whereas you will be wasting time doing so many unnecessary, unwanted things and all. There is a herbal called Kiranalli. If I don't mention about Kiranalli, then I would not be doing any justice. Scientifically, it has been proved that Kiranalli actually helps in the recovery of the jaundice. It is called as a hepatagogue. That means it helps the liver cells to tolerate and endure the viral infection. And as a result, liver cells will rejuvenate its energy and recovery is very fast. That is indicated. And that is also available in the form of tablets and in the form of syrups also. That can be taken, that has got the curing effect. Whereas the other things like unnecessary traveling to distant places, telling that if you go there, the jaundice will be over. If you do this, the jaundice will be over. No. The jaundice has come is it will stay there as your guest in your body for a fixed number of times. Only there it will go. Otherwise, it will not go. Your attempts are futile. Similarly, measles comes the same way. Mumps, is called infective hepatitis. We get a swelling near the ears and all. It will stay there with or without fever and it will go up. In fact, when children get all these infection in their childhood itself before the age of 12 years, it is good for them. If childhood population gets all these infections in the childhood age itself, it is good. It is something like getting the immunity from the natural resources. It is something like vaccinating them. Otherwise, if the child is not getting the measles in the early stage of his life, at the time of exam going when he is in a +2 and a degree course, if he get the measles, then havoc. The recovery period is also long, and at the same time, loss of school, loss of duty, everything is lost. So we should not puzzle, we should not lose heart when our child is getting the measles. when the child is getting chicken pox. But the question of dengue is entirely different. Dengue is a viral infection, and at the same time, it is brought out by a virus by the bite of mosquitoes and all. Not to go into the details, but the only thing is it is a challenging disease when compared to other simple viral diseases. It has to be met with challenge of leukocytopeniasis, particularly the fall in the platelet count. It is a bleeding, it will cause bleeding diathesis. It is a hemorrhagic disease. So we need to take care. Sometimes they need to be admitted in the hospital also to take care and follow the outcome of the disease, the progress of the disease and all. So bacterial infective diseases, typhoid, respiratory infection, pneumonias, septicemias, urinary infection, tuberculosis, and deep abscess. These are all the bacterially infected diseases and all. Here also so many misconceptions are attached. For example, I tell you, when the urinary infection is there, the infection will cause you burning of the urine, which we call it as a dysuria. The burning of the urine is mainly because of the bacteria, which is actually multiplying there in the bladder and the urine. Whereas the misconception is, if somebody is telling at home that I am having dysuria, that is burning urine, the immediate answer from the family member and the friends is, उनको सूड आइट गर्मी हो गया, इसके वजह से है ना पेशाब में जलन आ गया है, पानी ज्यादा पियो और ठंडे चीज़ा लियो. कैसा ठंडे चीज़ा लियो? दही लियो, कर्ड, butter milk and all those things are good for you, but you are not directing your treatment to the cause. Direction of the treatment to the cause is very, very important. So urinary infection is because of the bacteria. We have to do the culture of the urine and find out the which strain of the bacteria is there multiplying in your bladder, in your urine, and we have to take appropriate dose of antibiotics. Otherwise, the infection will spread upward to the kidney and it may bring a lot of complications to the kidney. Similarly, so we should not attach the misconception that burning urine means garmi ho gaya. It is not like that every time. Burning urine means there is an infection, particularly diabetic people more tend to have this urine infection. Then when it comes to tuberculosis, a person will be having cough for several months even, thinking that is a simple cough, taking medicine from the counter, not going to the doctor, not finding the cause, root cause of the cough. Root cause of the cough for that particular person could be due to tuberculosis, which we commonly call a TB. What happens when the disease progresses to the second or third stage? The person coughing during the bouts of heavy cough, he may cough out the blood also. When the blood comes again, people will come and join and tell him that, you coughed up. Though I am talking about the misconceptions which was harbored by my ancestors those days also. But nowadays it has reduced to much lesser extent. When a person is coughing means immediately he will return as ஏதோ ஆயிடுச்சு உனக்கு வந்து நீ ब्लड कक्कर है तुम है ना खून के खाई करते हो तुमने कोई जादू कर दिया है जादू टोना कर दिया है किसी का बद्दुआ लग गई है इसीलिए तो तुम खून के खाई कर रहे हो खून का खाई खैर करके मर जाएगा. So these are all the misconceptions attached to tuberculosis from those days. If the blood stain, the mucus is coming out, you should take it very seriously that it is a matter of chronic problem. You should go and consult a doctor. And similarly, in the pneumonias also, we try to explain to the people that pneumonia means it is the, what we call it is assault to our lung tissue. The lung infection, which is, there is a florid infection of the lung tissue with the bacteria or the virus, it will cause pneumonia. It could be a viral pneumonia or a bacterial pneumonia or a tuberculous pneumonia. So finding the cause is very, very important. Similarly, respiratory infections are common day to day. It could be because of the fumes, chemicals, dusty atmospheres, dust allergies and all, pollen allergies and all, and that may cause frequent respiratory infections. Bacterial infective diseases, typhoid, I told you. Typhoid also, there is always a misconception. When a doctor tells that your son is diagnosed with typhoid by doing tests, immediately what they do, you might have heard of typhoid means crush the orange, stop all food. No, it's not like that. Orange is good. But the thing is, the citrus fruit is causing allergy, and as most of the citrus fruit will cause allergy to the people, more particularly to the children. Already, the person is harboring typhoid bacteria in his blood. We need to treat the typhoid infection effectively with the help of the antibiotics, injections, and tablets. During the course of the treatment of this, if the person is taking citrus fruit, that may cause allergic to him, and because of the allergy, the virus infection may come because of the citrus fruit allergy, and then there is an onset of another type of fever. Then the doctor will be confused whether he is dealing with the allergic infection or whether he is dealing with the typhoid infection. So avoid the thing which is told by the doctor to be eaten, and don't refrain the patient from taking food unless and until the person is having frequent vomiting, bouts of vomiting, and the stomach abdominal coli. You need not restrict the solid food. You can, before give the food, you boiled egg, high protein diet to the typhoid patient also. Don't restrict the food. The misconception is typhoid means stop all the food. You can G. It's not like that at all. He needs protein to build up the body. He needs protein to rejuvenate his system. So eggs are very important. So these are all some of the misconceptions attached to this bacterial diseases and viral diseases and all. Are there any slides
Yeah.
still there?
Yeah, Dr. Sir, we have the last slide, but I would request that we wind up earlier so that we can take up question answer.
Yeah.
Okay, sir.
Are there any doubts first in what is dealt with? I don't know. I don't know how you all felt about this. There are cancers topic are there, but time is running out. It is already 1 o'clock, 1 hour past. Are there any doubts?
Yes, sir. We have few questions in the chat box. Do you want to continue with the current slide, or shall I read out the questions?
Let them have the doubts because time is running out.
Okay, sir. Yeah, sure. So I'll put you on the main screen, and then, yeah, right, sir. The first question is it necessary to drink 6 liters of water daily?
See, God has given the tremendous capacity, the capacity of limiting our needs. You your capacity of your thirst. If you feel thirst, if you go out, roam about in the hot sunny days, you will be feeling thirsty. That itself is the manometer to tell you that you need more and more water. 6 liters of water and all these dictums are made by people who think on their own past legislations. It is not like that. But one thing is, taking more water in the early stomach is very important. When you get up, you take more water because during your busy life, you are not likely to consume the quantity of water which is needed for your body. Especially after taking the food, especially the lunch, we should not take more water. We should take a small quantity of water, say about 100. Sir, somebody raised this question about drinking 6 liters of water, 4, 5 liters of water. It's all not like that. Nature will control your requirement. That's what I was telling, but I think in the middle I lost the contact. But it's always for your advantage that if you do sufficient reserve of water in the empty stomach, which is a healthy way. Because when the stomachs are empty, you can take plenty of water to give reserve for the whole day long. Oh, it's audible to you. So again, I have to repeat about the water requirement. There are no fixed rules to take so many liters of water, this, that, and all. Because nature has given a biological control in our body in such a way that whenever we need more water, because thirst is the triggering factor. If we take 1 tumbler of water, drink more and more water. That is the biological control. But it is always good for a person to take, if you take more water in the empty stomach, because he is going to load for the day's requirement of that water. And secondly, those who are suffering with kidney stones, renal stones, it is always better to take more water compared to a normal person, which will help him to wash away the microleaks. Anything else? There is no fixed limit.
Ramadan fasting and diabetic precaution thereof.
See, this question has already been raised on several occasions about Ramadan fastings and diabetics, how it is possible and all precautions thereof. See, it should be very clear to all of us that during Ramzan also, we don't miss a little thing to be taken or not to be taken. We consume everything both in the solid and the liquid and all. Only thing is we are changing the timings. So whatever we do during the daytime, we do in the night time also. So net and net, the amount of water consumed by a person who is fasting is also going to be the same. If he is taking 3-4 liters of water in a 24 hours time, during Ramzan also he is taking 3 to 4 liters of water. Starting consuming more at the fasting layer, इफ्तियार के टाइम में पानी ज्यादा पिएगा, उसके बाद में थोड़ा थोड़ा करके पिएगा, फिर सहर में पिएगा, आधी रात को पिएगा. तो water consumption is no way causing the water deprivation to the person. He ends up in taking the total volume of water which is required to survive, whether he is a diabetic or non-diabetic. That is not a matter at all. Only thing is we are changing the timings, that's all.
What should be the ideal dinner time?
Instead of, I would like to change this question slightly. The ideal, if instead of asking the ideal dinner time, I would put it this way. Never go to sleep soon after taking your dinner. After taking your dinner, whether heavy or light, you should spend up to 1.5 to 2 hours. During that time, you should either sit watching to your TV and talking to your relatives, or you should walk. Having a gentle walk at night is also good after your supper. So dinner time is not an ideal time. Dinner time starts from 7 p.m. itself. If you want to go to bed early, you have and complete your dinner earlier. But the thing is, you should keep yourself awake 1.5 to 2 hours of taking the dinner. That is very important.
The world has advanced. Why shall we go to Ambur or Vellore for MRI? Why all the doctors can't open one dedicated diagnostic center wherein all scanning can be done?
Unfortunately, most of the doctors, including me, are not entrepreneurs because they actually concentrate on the diagnosing skill, looking at the patients and all. The main asset of a doctor is his diagnostic skill. He spends more on time with the patient, taking the history, finding the diagnosis, searching for the disease cause and all. And most of the doctors don't know where to invest in such big machines and how to earn. But if there are certain family members to help him, they come in and they suggest the doctor that let us have a big lab and with heavy equipment and all. MRI scan, why it is not being brought to Vani for a long time means because of the heavy cost incurred in buying that equipment. Wanembadi is a small town, but it has grown to immense potential nowadays. Growth is also there. But previously, nobody thought of bringing a MRI because the cost of that MRI machine is in crores. Just now, the doctor has come out from the MBBS after spending a lot of money for education and other causes and all. And after that, he has to set up a small clinic. Who will fund him? The funding is the major headache and problem for the doctor. And secondly, in a small town for MRI, the prescribers, other doctors suggesting the patient to take the MRI is very minimal. At the same time, the takers are also very minimal. So the doctor will end up in losses after getting loans from the bank. I have seen so many people acquired loan from the bank, nationalized banks, and they suffered losses because there were no takers. And if the doctors are prompted to write MRI for trivial causes also, again the public will accuse the doctors. For nothing, for go for a common cold and all, he will ask ask the patient to do MRI and all. It is a business trick. So that should not be the trend. If you take the old doctors, still they adhere to the simple treatment to start first, and then only they will subject the patient to elaborate investigation. And another thing is the rampant growth of these diagnostic tools are mainly because of the doctors' intrusion under the purview of the consumerism. When the consumer code came, and the onslaught of consumer, it is something like a sword hanging on the neck of the doctor when the consumer court is applicable for the wrongdoings of the doctor. Previously, when I diagnose a person and tell him that you are suffering with typhoid, I diagnose the person mainly because of the clinical signs and symptoms and my experience. That will be 90% more. I will give him some simple instruction and start prescribing pills, and he will be all right in a matter of time, maybe maximum 1 week. But nowadays, unless and until I have a valid documentary proof for the positivity of the typhoid infection, I am answerable to so many questions if I am sued. Because now, for trivial things, also people are willing to go to the court and sue the doctor also. If that be the case, doctors are warned off. Now they have resorted to writing results after results because they want to safeguard their own. It is for the self-safety. Most of the tests are written now. It becomes a burden to the patient to spend more.
Alhamdulillah, this session is very informative, and mashallah, the doctors have explained all the myths and misconceptions of various diseases in a very good way. What's the reason if we have dengue, platelets values has
Decreased.
been decreased? Yeah.
Yes.
Yes. Yeah, you can go ahead.
In my experience, I'm happy you know that platelet counts are decreased. That is called decrease in the number of platelet count may result due to the infection of the dengue virus. That will result in bleeding diathesis. Patient may bleed internally, patient may bleed what is visible from the nose and all. Internal bleeding is very risky. And still, not only the patient, doctors also think that a leukocytopenia together with the platelet count is also risky to the patient, but there are certain limitations. Some doctors grew panic when the platelet count decrease below 1 lakh. But in practice, it's not like that. Very recently, last week also, one of my patients who got admitted in the government hospital, his platelet count dipped to 85,000. And he was then written a prescription and asked to go to Vellore government hospital because they don't want to the risk of that patient. Anything may happen because of the decrease in the platelet count. But in my experience, the patient brought that prescription of that government hospital, showed me the investigations and all. When he saw that, I know the cause, what triggered that government hospital to immediately refer the patient to Manimadi government hospital to Vellore government hospital. That's because of the platelet decrease in the platelet. But in my experience, it is not so at all. The patient's attendants asked me and consulted me whether I should continue going to the Vellore or you can come forward to treat this patient. Looking at the platelet, I said, I laughed to myself internally. Then I said, oh, nothing, Baba, you bring that patient. Then that patient attendants brought that patient. I kept him for just 4 days, that to giving him the night relief, go to home and then come back because of the want of staff area. The patient is perfectly well and he is from Zafrabad by name Ubaidullah. And he got cured of because of the platelet reduction in the number that was only 80 plus. In my experience, until up to the platelet count is reduced to 40-45,000, I have seen being treated patients with 45,000 also got well without any mortality. So there is nothing to panic in the drop in the platelet count. But immediately patients will be told by the doctor only about the platelet count, not about anything else. Apart from the platelet count, there are so many things which has to be side valued. The age of the patient, the associated morbidity, whether the patient has succumbed to some previous surgeries and all, or whether the patient is anemic, or the patient has got some comorbidity also. Is he in a convalescent state, or the lady is pregnant? So many things have to be evaluated apart from that platelet count and all. And then the doctor comes to a final conclusion that the patient is fit to be treated here in a jollyful way without wandering to any such big centers having big facilities.
Okay. Is it necessary for a person with high BP to take medication every day, or can they monitor that regularly with machine and take tablet when needed?
Yes. Remember, diabetes and hypertension. Once it is established means it is like a thappa lagai jaisa, a patient ko. Before I call you, you are a diabetic or hypertension, one doctor has to think twice, thrice, and 4 times. Then only he has to say that the given patient is diabetic or hypertension. Because if I put the label that a given person is a diabetic, then the other doctor immediately pass it on as a diabetic patient. Third doctor also will pass it on as a diabetic. Because he will not evaluate to himself, because it is already decided drug is prescribed by other doctor, the first doctor. If the first doctor makes the mistake, the second doctor will blindly follow. Are you a diabetic? The first question he will ask, are you a diabetic? The patient is diabetic. Yeah, why? Because the such and such doctor has given the prescription. I am diabetic for the past 4 or 5 years. So there is no necessity for the third or fourth doctors to evaluate first that the given person is diabetic really or not. So a person who is diagnosed to be diabetic, a person who is diabetic to be hypertension, needs to be under continuous monitoring lifelong and to be taken drugs more or less, or to be taken drug alone or with the insulin, or to be maintained without the drugs, just with the exercise and diet alone and all. These things are to be decided and judged by the doctor. So, but one thing is certain, whether you are diabetic or hypertension, continuous monitoring and continuous treatment is very important. You cannot judge yourself. You can, when the blood sugar comes down, you cannot stop the blood sugar level dropping down, because you cannot stop the medications for controlling the diabetes. You need to take the medication. If you want to reduce the medication because of some side effects, you go and consult the doctor. Should I continue the same medicine? You are going to change the medicine because of the side effects with which you are suffering. You cannot stop on your own, both for diabetes and hypertension.
Yes, sir. So I think we are at the end of the session. Thank you so much, Dr. Saab. It's very useful information for us. Okay, so
wind
can I
up?
do the Jazakallah khair, and
thank you very much for your patient listening. I don't know how many members were there. It has been my fond habit to tell the people, especially in the medical side, what is wrong, because I get irritated when people follow the wrong path during the course of their treatment. They don't understand what is what. They decide on their own. The misconceptions prevailing among the people, not only with the illiterate, and the illiterate people also are behaving the same way. It is for your own goodness I presented this, and I have been doing it for so many years also. If you are benefited, least of you are benefited, that is good for me. Inshallah. Wish you best life ahead.
Jazakallah khair, Dr. Saab. On behalf of Graduates Guild Wanebadi, I would like to thank Dr. Saab for taking his time, valuable time, and giving us insightful information about the medical science and the health sciences as well. So it's been inspiring to see Dr. Saab. I was one of his patients since my childhood. My mother and grandmother used to follow Dr. Saab advice really well, and we have been fortunate enough that we have Dr. Saab and Zahida ma'am, Dr. Masood Ikram sir with us, who are eagerly helping people as we grow. So thank you so much, Dr. Saab, for accepting the invite, and it's been a great pleasure. We would like to hear from you more in the upcoming days and sessions.
I thank GGV for giving me this opportunity. Thank you, one and all.
Thank you, sir. The meeting has been recorded. Inshallah, we'll be uploading it soon on YouTube and share the links with all of you. We'll end the meeting now. Subhanakallah. Assalamu alaikum.